we are overlooking the nature and we are getting results by artificial methodologies, and that is called ICSI and IVF. Even the ICSI is going to do the same thing. So what we have to do is, let's make sure that our child should be healthy and happy. So now we are into the 22nd part, and it is like, what are the outcomes and risk in going through IVF and ICSI programs. So as we are all aware, IVF and ICSI has been happening for the last 30 to 40 years. ICSI for more than 30 years and IVF for almost 50 years. So what is the thing is like, when this has been into existence for almost more than 30 years, the ICSI babies have gone to the next generation. So like, broadly if you say, there are no major setbacks, there is nothing like an alarming situation, but definitely yes, a woman who's undergoing a stimulation with excessive hormones, sometimes steroids, so many medications are administered for her. So these hormones, medications, supplements, injections, everything is giving a lot of pain, weight gain, some sort of hair loss, as all these problems are happening. So women are having some immediate effects if you are using something excessively. So that is why nowadays this soft stimulation, minimal stimulation, so many things are all coming into the system. So first thing is, we need to keep in your mind, now the immediate consequence for a woman is something like this, and the long term is maybe sometimes a tumor or a myoma or a cyst, something will happen because of excessive hormonal medications. So these are also some things happening on a long term. This is from the female side. And what is the consequence on the baby side? So we need to understand, most of the time during the pregnancy time, the mother is going for a preterm labor or an early labor. So because of that, the child is going for an NICU care. So early labor and the child is going for NICU care means it is something a setback. And sometimes, as we all understand, we are overlooking the nature and we are getting results by artificial methodologies, and that is called ICSI and IVF. So what happened is, sometimes like if we are not really prepared well, or we have too much of compromise and still we have managed to got the result, it will have some definitely impact on the baby's outcome. Sometimes we see so many problems with the babies, like so many disorders, mental disorders, some sort of syndromes, some sort of problems also happening in the babies. So we have to admit, we have to accept, we are transforming our genetics to the offspring. The paternal and the maternal. Paternal is father and maternal is mother. So when these two genes are united and getting transformed to the offspring, whatever good and bad from the father and mother will go to the baby. It's a universal law. Even the ICSI is going to do the same thing. So what we have to do is, let's make sure that our child should be healthy and happy. So normal. And for this, what best I can do from my side? I will use the technology, I will use this methodology to get a baby, but I will ensure that I will try all the other methods, like a natural pregnancy or an IUI or whatever it is. I will try seamless efforts, I will do my best, and completely I will restore my health. And in the process of that, if I am not able to succeed by naturally or by IUI, definitely not only the results will be uplifted in ICSI, but the outcome also will be very assuring. That is, the baby will be healthy. So this is the way we should think forward. So outcome of ICSI and risk of ICSI and long-term sequelae is being well explained. It's all, once again, the couple's thing has to be kept in mind. Their health and their genetic problems will be transformed to the offspring. And so if you are definitely keeping that in your mind and doing in some way better, automatically it will show the positive in the offspring. So no, not be worried, it will be very much acceptable. So we'll see in the next part.